Neuro and musculoskeletal diagnostics. Arthroscopic procedure. Arthroscopy is a surgical procedure used to visualize, diagnose, and treat problems inside a joint. Cerebral angiography is an invasive test that involves the injection of contrast media into the carotid artery by means of a catheter threaded through the femoral or brachial artery. Radiographs are taken as the dye works its way through the cerebral circulation. Angiography may be utilized to identify bleeding aneurysms, vasospasms, and arteriovenous malformations, and to differentiate embolism from large artery thrombosis. The extremity is kept immobilized after the procedure. The nurse would check the extremity for adequate circulation by noting skin color and temperature, presence and quality of pulses distal to the injection site, and capillary refill. The brain is the most demanding organ, and it needs continuous blood supply. Cerebral blood flow is the flow of blood through the brain and is important for delivery of oxygen and removal of waste products. An increase or decrease in cerebral blood flow will cause an increase or decrease in cerebral arterial blood volume because of arterial dilatation or constriction. Cerebral blood flow is maintained at a constant level despite usual fluctuations in blood pressure by the process of autoregulation. If the cerebral perfusion pressure falls below the critical value of 70 millimeters of mercury, the patient will have inadequate cerebral perfusion. Autoregulation will cause cerebral vasodilatation, leading to a rise in brain volume. The picture is an assessment of cerebral blood flow using CT perfusion. This patient suffered a subarachnoid hemorrhage secondary to an anterior communicating artery aneurysm. CT or CAT scan is best suited for viewing bone injuries, diagnosing lung and chest problems, and detecting cancers. The MRI is suited for examining soft tissue and ligament and tendon injuries, spinal cord injuries, and brain tumors. CT scans are widely used in emergency rooms because the scan takes fewer than 5 minutes. An MRI, on the other hand, can take up to 30 minutes. An MRI typically costs more than a CT scan, and one advantage of an MRI is that it does not use radiation while CT scan does. In the top left picture, this is a patient that was in a bed and had her leg fractured, because the magnetic pull of the MRI pulled literally the whole bed into the opening. The top right, it was a floor waxer, and the bottom left is a wheelchair, and the bottom right is a fully loaded pallet jack just sucked into the bore of the MRI system. The more mass an object has, the more dangerous it can be. The force with which is attracted to the magnet is much stronger. So like mop buckets, vacuum cleaners, IV poles, oxygen tanks, patient stretchers, heart monitors have all been pulled into a magnetic fields of MRI machines. Smaller objects can usually be pulled free of the magnet by hand. Large ones may have to be pulled away with a winch, or the magnetic field may even have to shut down. Prior to allowing a patient or support staff member into the scan room, they must thoroughly be screened for metal objects and not just external objects. Often patients have implants inside them that make it very dangerous for them to be in the presence of a strong magnetic field. Metallic fragments in the eye are very dangerous because moving these fragments could cause eye damage or blindness. People with pacemakers cannot be scanned or even go near the scanner because a magnet can cause a pacemaker to malfunction. Aneurysm clips in the brain can be very dangerous as a magnet can move them, causing them to tear the very artery that they were placed to repair. Dual energy X-ray absorptiometry. This is a bone density scan called a DEXA, and it evaluates bone mineral density and the degree of osteoporosis. X-rays would be used to assess for the presence of fractures. Bone scans would be used in the eval of osteomyelitis and potential bone cancer. Electroencephalography, an EEG. This is a test used to detect abnormalities related to electrical activity of the brain. This procedure tracks and records brainwave patterns. The brain cells communicate via electrical impulses and are active all the time, even when asleep. Normal electrical activity in the brain makes a recognizable pattern. An EEG is one of the main diagnostic tests for epilepsy and may also play a role in diagnosing other brain disorders. Graphically records the electrical activity of the cerebral hemispheres. Sleep deprivation may be done and anticonvulsants possibly withheld. The most common reason an EEG is performed is to diagnose and monitor seizure disorders. An EEG can also help to identify causes of other problems such as sleep disorder and changes in behavior. EEGs are sometimes used to evaluate brain activity after a severe head injury or before heart and liver transplantation. Electromyography is a test that checks the health of a muscle and the nerves that control the muscles. Evoked potential studies measure electrical activity in the brain in response to stimulation of sight, sound, or touch. Stimuli delivered to the brain through each of these senses evoke minute electrical signals. These signals travel along the nerves and through the spinal cord to specific regions of the brain and are picked up by electrodes, amplified, and interpreted. Evoked potential tests record how quickly and completely the nerve signals reach the brain and are used because they can indicate problems along nerve pathways that are too subtle to show up during a neurological examination. The disruption may not even be visible on an MRI exam. Visual evoked potentials, the patient would sit before a screen in which alternating patterns are displayed. Audio evoked potentials, the patient listens to a series of clicks in each ear. Sensory evoked potentials are short electrical impulses are administered on the arm or the leg. Motor evoked potentials, these can detect disruptions on a motor pathway of the brain or spinal cord, such as MS. Laboratory tests. The patient would need a full set of labs to view electrolyte and volume problems. Blood cultures would be necessary. Here I wanted to show the colors of cerebral spinal fluid. A would be clear. B is hemorrhaging. There's bleeding in the CSF. Yellow means that bilirubin is present. There is a breakdown of red blood cell parts. And then D, pink, red, or orange means that red blood cells are present. Discography, also called a discogram. This is a diagnostic procedure used to determine if one or more discs are the cause of back pain. The procedure involves pressurizing the discs by injecting them with a sterile liquid to induce pain in the affected disc. Remember that they should be up in a reclining position for at least 2 hours. A lumbar puncture is a common medical test that involves taking a small sample of CSF for examination. CSF is a clear, colorless liquid that delivers nutrients and cushions the brain and spinal cord or central nervous system. Most lumbar punctures are done to test for meningitis, but they can also determine if there is bleeding in the brain, detect certain conditions affecting the nervous system, such as Guillain-Barré and multiple sclerosis, and administer chemotherapy medications. A lumbar puncture is considered a safe procedure with minimal risk. Most of the time, there are no complications. In some instances, a patient may get a headache, and it's recommended that the patients lie down for a few hours after the test and drink plenty of fluids to help prevent headaches. And in rare cases, infection or bleeding can occur. This is contraindicated in patients with increased intracranial pressure. Spinal fluid is sometimes removed by lumbar puncture for the purpose of decreasing spinal fluid pressure in patients with uncommon conditions, such as normal pressure hydrocephalus. A muscle biopsy is relatively simple and takes approximately 1 hour to perform. The stitches close the incision will dissolve so they do not need to be removed. Small paper tapes will be placed over the incision to keep the skin together. A sterile dressing is applied over the paper tapes, and the dressing stays on for 7 to 10 days. A myelogram is a diagnostic imaging procedure done by a radiologist. It uses a contrast dye and X-rays or CT to look for problems in the spinal canal, including the spinal cord, nerve roots, or other tissues. It is also known as a myelography. A nerve biopsy takes about 1 hour. The incision is made above the outer ankle bone, which is the sural nerve, and is about 5 inches. The rest of the procedure is similar to a muscle biopsy. When the nerve is clipped, the patient may feel an electrical sensation. A pressure dressing by use of an ACE wrap will be placed on the site. The pressure dressing will be on for the first 24 hours to avoid bleeding and swelling. Diagnosing Parkinson's disease is sometimes difficult since early features may be difficult to assess and may mimic other disorders. For example, tremor may not be apparent as a person is sitting at rest, or posture changes may be written off as osteoporosis or simply a sign of aging. There are currently no sophisticated blood or laboratory tests available to diagnose the disease. CT or MRI scans cannot confirm a diagnosis of Parkinson's because the brain changes in the disease are microscopic, but they're useful in ruling out other conditions such as brain tumor or stroke, which can produce similar symptoms. A positive emission tomography scan, a PET scan, uses 18-fluorodopa, a form of the Parkinson treatment drug levodopa, to measure dopamine neurons in the substantia nigra area of the brain. The symptoms of Parkinson are caused by the loss of the dopamine neuron. 18-fluorodopa is injected into the patient and then the brain is scanned. The scan is very sensitive to the dopamine cells, and many people with Parkinson's will have an abnormal PET scan. Transcranial Dopplers give information about the flow velocity in brain arteries and veins and used to diagnose vasospasms and trend severity of the velocity. Blood flow velocity increases as vessel diameter decreases. Transcranial Doppler is a form of ultrasound in which high-frequency sound waves bounce off or pass through body tissue. Just as a siren's pitch sounds higher when it's moving to you in a car, so does a transcranial Doppler pitch go higher when blood flowing toward the transducer. It goes lower as it flows away. This is because it's bouncing off the red blood cells moving in the blood. It is these pitch changes that produce the audible sound. In brain injury protocol, nurses can be trained to do transcranial Dopplers at the bedside every morning before physicians come and do their morning rounds. This daily measurement checks blood flow velocities in patients with vasospasms and subarachnoid hemorrhage. An X-ray creates images of the bones and internal organs. It is used to detect bone or joint problems or to check the heart and lungs. An X-ray works by sending small amounts of radiation through the body. Another form of penetrating injury is shown on the anterior-posterior X-ray of the skull, showing nails from a nail gun stuck in the skull and penetrating the right frontal lobe. The patient was neurologically intact on presentation. The difficulty is the bleeding that can occur deep in the brain when the nails are removed. The one on the right shows a stabbing.